Hello, everyone. Thank you for attending today's webinar. I'm Stephanie Chayeski, and I'm the Executive Director at the Society of Trauma Nurses. This session is being recorded so that it can be offered as on-demand CE for our members and attendees. Your line is muted, but if you have any questions during today's session, please type them into the Q&A panel in Zoom, and we will answer them at the end of the presentation. The Society of Trauma Nurses is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. This program has been awarded 1 hour of continuing nursing education. For successful completion, you must attend the entire activity. You will receive an email with a link to download your certificate later today. Today's topic is defining the needs of nurses worldwide. At this time, it is my pleasure to introduce Helen Jowett, Chair of the STN International Committee.
Thank you very much, Stephanie, and welcome to everybody online. It's our absolute honor and privilege to be here with you today, sharing some of the knowledge and lessons that we've learned from across the globe, and as we're focusing on defining the needs of nurses worldwide. Thank you, Steph. Slide, thank you. Today, your presenters online are myself, Helen Jowett from Australia. We've got Stephen Krogh Larsen from Denmark, Knut Magna Kolsterbraden from Norway, Krongdai Unhasuta from Thailand, Diana Scaff, United Arab Emirates, will hopefully be joining us, but we have United States of America, Mike Glenn, and Tracy Cotter-Padder from the United States as well. Next. We're going to provide an overview of the International Council and Committee, that is the subcommittee of the Society of Trauma Nurses Board. We're going to look at the International Trauma Survey that we disseminated across the globe last year and received over 1,000 responses to. We'll introduce you to the Global Trauma Quality Improvement Initiative that's been in action now for several years, and lead you to resources that are available there for your use and for you to access. We'll provide an overview on the World Health Organization Basic Emergency Care course, while also looking at different options for the Society of Trauma Nurses and the many varied courses and resources that are available through their education and training programs. Next. So what is the International Council? It is a committee that is used to promote international participation, and we're here to make sure that we develop resources that are, equitable, that they're useful, and that they can be used within your environment. And the whole reason and goal behind that and objective is to ensure that we get optimal trauma care for all people globally. We're really wanting to seek opportunities for collaboration and any education and innovation that we can do. And we make sure that we do that right across the continuum of care, from when the patient is injured all the way through to the other end of the journey through rehabilitation and discharge home. Next. We've introduced some of the members, and I won't read everybody out, but you can see that all areas of the globe are represented there, from the North Americas down to Latin America, Africa, the Middle East, Asia, Africa, Europe, and Oceania. Next. And just to put a face to all these names that you've looked at, our members are made up, as we've talked about, the different countries that they represent and the different cultures and systems and backgrounds. And you can see on the screen here, we have myself from Australia, Stephen, Jordan, we have Iman Keys, Norway, Knut is going to present today. We also have Sonia Chauhan from India, and on the line today we have Christiane Dominguez from Brazil. Unable to join us today, but a very valued member from South Africa is Renee Ackerman. Krongdai Unhasuta, who I introduced before, will be presenting from Thailand, and Mike Glenn, maybe known to some of you through his work in ATCN from the USA. We also have Sang-Mi No from South Korea, who will hopefully join towards the end for some questions that you may have that you can put, and she represents the South Korean trauma nurses. Diana, I've introduced before from UAE, and Tracy, who's one of our presenters today, represents the USA. So you can see there's a varied group of different nationalities that are representing nurses right across the globe. Next.
So I'm going to present the results of the International Trauma Nursing Survey. So as Helen said, we sent out a survey last year in the fall, and then we got the results. And the aim with the study was actually to see what the nurses worldwide were searching for, or what they need to get support from STN, and who are they. So next slide, please. So the survey went out on social media, and we got a total of 1,035 responses. And looking into them, 1,022 were valid. So we had like some responses, but they didn't answer any questions. So then they weren't valid for the results. So if you look at the age of the respondents, most of them are in the beginning of their career from 20 up to 40 years old, and then a smaller part of the population is older. So this is very good for the survey, because then we could focusing on what are the need of the young nurses around the world. Next, please. And these are the different countries we got the response from. So Jordan was very high on top with 140 responses. And then we altogether had 50 different countries. So that's very, very good. But it also shows that um, our members of the international committee could share in their country, and then it got distributed. But it's also very important for us to reach out to countries we don't have a contact in, so that would be investigate in the future. Next, please. Looking at the gender, so the majority are female, and that's also the majority in the healthcare around the world. So I think it's a good representation of the nurses worldwide. Next, please. And looking at the level of education is quite interesting, because almost half of the nurses who responded, they have a bachelor degree, and some have doctor degrees, master, um, and some of them are postgraduate, and some of them are undergraduate. The tricky part of this survey is actually it wasn't in English, and if you have a survey in English, it also then you need to know the language. So if you are going to answer a survey in English, you need to know the language. So that's the reason why the education level is that high, is one of our hypotheses. Next, please. Looking at where the nurses are working. So the first bar, it's very small written, but the first bar, it's related to trauma. So it's in the emergency department and the ICU. So more than 3 out of 4 work in related to trauma. And then we have other areas. Most of them are working, they do have a clinical role. And just 10% or 11% they are in a manager role. Next, please. And 677 said they are working they have a quality program for trauma, and almost 300 they don't work in a trauma center. And this is something we want to look further into in a follow-up study survey later. Thank you. Next. And then the most interesting question was, what would you find helpful with STN? So it's a lot of things going on regarding education, and they want online training, but they also want like hands-on training. They need somewhere to share standards, protocols, guidelines, triage tools, performance and improvement indicators. Some of them need help to establish a trauma program, how to run a trauma service like management, how to work in a team, doing research, running a trauma registry, a mentorship newsletter. It was one suggestion that needed a trauma app so they could go in and look for information and knowledge. Multidisciplinary support, technological support for data collection, policy development, and data-driven decision making, and profession development and networking. And I'm quite happy because we already can give some of these. We could do education, we could do a trauma program and quality improvement, and we will tell you more about that later on. Thank you. Next.
Hi, my name is Mike Glenn, and I live in Seattle, Washington, here in the United States. I work at Harborview Medical Center, a level 1 adult and pediatric trauma and burn center. I've had the opportunity to work in a number of trauma-related positions, from pre-hospital to emergency, managing a trauma center and a state EMS system. In my current role with the Society of Trauma Nurses, I'm the International Director for ATCN, Advanced Trauma Care for Nurses. I'm a senior faculty member for the TOPIC course, Trauma Outcomes and Performance Improvement. I'm one of the founding members of the Global Trauma Quality Improvement Initiative, and a member here of the STN International Committee. I'll let Steve introduce himself when he starts his slides. Next. So the Center for Global Trauma Quality Improvement was started back in 2019, just as the pandemic was starting to disrupt just about every aspect of our personal and professional lives. You know, there was already a growing interest in performance and quality improvement at many hospitals around the world. You know, it was obvious then that the resources that many developing trauma centers needed were not very easily accessed or consolidated in a way to allow trauma providers to pick and choose the QI related resources and information that was most important to them. So that was the beginning of the GQTI program. Next. Quality and performance improvement at hospitals and clinics that provide trauma care, it varies greatly across the healthcare spectrum, right? The needs of any particular facility or group of providers is going to be unique. Even while we all understand that there are some very common universal principles associated with trauma QI, you know, sharing our perspectives and implementing these universal principles is one of the major objectives of the Center for Global Trauma Quality Improvement. Facilitating this in a digital virtual environment is a way to easily provide for many of the otherwise struggling folks that are trying to develop a QI program for their hospital or for their trauma center. Next. Clearly, the efforts of an initiative like this to address the wide needs globally needs to have a very expansive view of what QI is like globally, as well as the challenges of implementing this locally. The Society of Trauma Nurses recognized that the current trauma QI education and training was quite limited, and courses like TOPIC are not easily accessible globally, and in many ways may not meet the needs of hospitals and providers in areas where trauma care is still fairly young and developing. You know, looking to adapt and adopt to help disseminate a lot of the well-developed educational programs in QI from the World Health Organization and partnering with other international healthcare organizations and associations, we knew that was the path forward for GTQI. Next. The GQTI website was developed to be a resource library for trauma professionals working in a wide variety of environments. Educational documents, templates, examples of documents are just one aspect of this. There's a major effort to translate the World Health Organization's QI program into various languages. This was seen as an important step, given that a lot of trauma providers, nurses, technicians, medics may not have multilingual skills, and thus making these important resources pretty difficult to access and to use. Next. So clearly our efforts for an initiative like this needed to be pretty global, and I think that we're in a position now where we're looking for ways to push GTQI forward. So I would like to hand this presentation over to my friend Stephen, who's going to tell us more about the future of GTQI. Thanks, Steve. You're up.
Thanks, Mike. Hi, everyone. My name is Stephen. I'm an emergency and trauma coordinator in a major hospital in Denmark. And I've been working quite a bit of years with the quality improvement in our hospital. So now I'll continue. Next, please. The principles behind this, you all know that the need for improvement related to trauma quality improvement is well documented. And that's one the principles behind the GTQI is to create this virtual environment, like Mike said. And this extends into the thing that Knut talked about, that nurses actually do need this. So the QI is to get shared knowledge and resources, guidelines across the continuum of trauma care. The Center for Global Trauma Quality Improvement believes that these 8 focus areas that you see here are the way to help each other around the world. And I do have a few comments for each one. Collectability is that we do believe that if we do it collectively, we can help areas within low and middle income areas to achieve trauma quality improvement. It should be evidenced, and a lot of research is being made these days, and therefore steps towards quality improvement should be evidence-based. It's open sourced, and this is one of the things that we firmly believe in, that we should share knowledge, and it should be done in an open source so that everyone is available. It's available to everyone. Practical. So it should be easy for everyone to download the resources and put them to use within some minor adjustments. And timely, basically, and quote for this would be, don't wait 6 months to start fixing a problem if you see it. So should be done within a timely fashion, should be achievable. So easy to just, quite easy to use. Just choose a connection and use it. Yeah, and multidisciplinary fits all aspects of trauma care and treatment. So it's not just for the nurses, but it's something that should be achieved all the way around. And finally, free of charge. Again, we do believe firmly that should be able to save lives for all trauma patients, whether you have a big trauma center with a lot of money or not so much. So payment shouldn't be the limit. And these are the principles behind the GTQI. Next, please. And here you'll see a little bit from the page. If you look on the website, and you'll get a link in a little bit, you'll see under the resources 8 areas where you can find resources, and you're able to both download and upload if you have something to share as well. Under education, which is one of the things that Knut talked about, you will find an area including the basic emergency course, which Kranda will talk about in a little bit. So you should be able to find a lot of things in here. Next, please. This is the QI models from the WHO, and this seeks, we are built further on this. This seeks to provide guidance to support the efforts to establish a quality improvement program. There's a lot of range from techniques, but it emphasizes basic methods that you should be able to use in all countries globally. My highly recommendations to, if you want to work with trauma quality improvement, to download this, and it's available in both English, Spanish, and Portuguese for now, and getting translated as we speak as well. And this is a way to identify problems and implementing solutions as well. So really firmly do believe that you should download this as well. Next, please. And like I said earlier, GTQI seeks input, communication, and collaboration with all the stakeholders from around the world. You can register the website for free, and you're able to submit resources. I do believe that I just tested. It took 5 minutes, so it's an easy way to go around this. So I hereby invite everyone to join us. Everyone can contribute more than you know, and all are welcome to do so. Yeah, go check it out. Next, please. And this is the end for us. This is a link for the Global Trauma Quality Improvement System, our webpage, and has a QR code as well. So take a picture and save it. And I'll believe I'll give on to Grundy now for the basic emergency course.
Thank you, Stephen. Please. Next, please. I'm Grundy Unhasut from Thailand. I am the chairman of Trauma Nurses Society of Thailand and consultant to Trauma Association of Thailand. So we are the first, we talk about, let us begin with the course aims. The WHO emergency care course is the aim is to ensure participants to use ABCDE approach to assess the emergency patient and to identify and provide interventions for life-threatening conditions. And the last one is when the participant must understand when to call for help and when to refer a patient for higher level care. Please, next slide. And the course overview, we have like a 5 topics. The first one is the ABCDE and sample history approach. And the follow is approach to trauma, difficulty in breathing, shock, and other mental status. The next, please. So when you see this from this slide, you see why the ABCD is our approach and why is the goals. So because our ABCDE approach is very important for the patient, like a systematic way, and when we communicate in our team, it's like a ABCDE, we can talk. So the goal is when we use ABCDE approach and sample history approach, so we can identify life-threatening conditions rapidly and ensure the airway stay open. And the last one, we ensure breathing and circulation are adequate to deliver oxygen to the body. The next, please. So when you see this slide, you can I have two topics in one slide. The first one is the ABCDE approach. You see this airway, breathing, circulation, disability, and posture conditions. And it's like the next, you can see sample history approach. Consists of signs, symptoms, allergies, medications, past medical history, last all intake, and events surrounding. The next, please. And this is very important for us when you have enter patient, you must approach to trauma. And in WHO emergency care course, it consists of 3 phases. The first one is ABCDE trauma primary survey, and after sample history, and the last one is trauma secondary survey. If any life-threatening problems are identified, stop and manage them, then return to ABCDE. But The trauma secondary survey is a complete head-to-toe examination after primary survey. The next, please. And you see this like trauma important conditions. We care, we assess, we treat, and we give the interventions of every part of injury, and we use like body regions, and you have you must know how to treat head injury, how to treat fracture, or you must know how to treat open fracture, how to care the patient injury with clutch injury or blast injury or burn injury. The first next please. And this is very important approach to breathing. You see, everything we must start with perform A, B, C, D, E first. And after that, we treat life-threatening conditions and take a sample history and do an physical examination. But only the information will you receive from the first one to the second, 3, and 4. So you think about the cost, and after that you think about consideration in adult and in children, and after that you must to transition and transport to the level of trauma care. The next, please. Approach to shock. Because we know, shock is come from the body, the tissue lack of oxygen to deliver oxygen to the tissue. So we have a poor perfusion, but poor perfusion is come from many causes, such as dilate, blood vessel, fluid loss, blood loss, and heart problems. The next, please. These are the mental setbacks. You see, we have 2 goals. The goal of initial assessment, and the second is the goal of acute management. The first one in initial assessment, when you assess the patient with other mental setbacks, you must identify rapidly reversible cause of other mental setbacks, and you must recognize dangerous condition because requiring to transfer. And the goal of the acute management of other mental setback, you must ensure blood, oxygen, or glucose reach to the brain, and you must protect the brain from additional injury. The next, please. And these are I have scanned the QR code from WHO Basic Emergency Course. We can see the impact of basic emergency care training on patient outcomes. So I would like to leave you and thank you for your time. Thank you. The next topic.
Hello, my name is Tracy Cotner-Pouncey, and I am the current Director of Trauma Services for UC Health in Northern Colorado. And for this webinar, I represent the United States of America. I also proudly serve on the STN International Committee and also serve on the STN board as a director at large. It is my privilege to kind of wrap up this webinar with the focus on education and training, which as Knut started off our webinar talking about, this is one of our main focuses and needs across the globe. STN continues to be leaders in the industry related to trauma education. So we are going to start with ATCN. ATCN is Advanced Trauma Care for Nurses course, and it may be the course that you are most familiar with through the Society of Trauma Nurses. The Advanced Trauma Care for Nurses course is a global course that focuses on trauma resuscitation. This is taught in collaboration with the Advanced Trauma Life Support course, or ATLS. It fosters critical thinking, and through the dynamics of ATLS and ATCN, builds a team collaboration. Next slide. TOPIC is another one of our courses through the Society of Trauma Nurses. TOPIC stands for Trauma Outcomes and Performance Improvement course. This is also a course that is held globally. It can be done in person or also virtually. So the modules are set up to not only build, but to enhance your current performance improvement process, which, as we know, is a focus for all of our trauma programs. There are relevant case scenarios that are established within the course, and we also have a rural topic course that is really focused for those level 3, level 4 trauma centers, or the more rural trauma communities. Next slide. The Trauma Certified Registered Nurse Preparatory course, or TCRN preparatory course, is established for the preparation for TCRN certification. It is a one-day course, and it focuses on 7 main areas of focus. With this course, there is a study guide and an application that is available. Next slide. One of our newer courses to the STN educational stack is the Pediatric Trauma Across the Care Continuum, or PTAC. As you can tell by the title, it is pediatric focused trauma care. It is also a one-day course, and it has hands-on skills focusing on this particular special patient population. Next slide. We also have the Optimal course. Optimal is Optimal Trauma Center Organization and Management course. And this focuses really on our aspects of trauma center or trauma program management and how to successfully go about establishing and maintaining your program. It is really preparation for trauma accreditation. So how do you prepare when you have reviews for your trauma center? It is also a one-day course, and is designed for trauma medical directors, trauma program managers, and administrators. Next slide. And coming soon, we are very proud to announce that we have the Advanced Trauma Program Manager course coming. This is a newly developed course based on needs identified by our STN community. It is a 2-day intensive course for trauma program managers. And notice it does say advanced. So this advanced programming really talks about financing. It talks about staffing models and all of those administrative aspects of our program that are so important. It is also a scenario-based program, and its planned rollout is for the 4th quarter of 2024. Next slide. One of the things we want to make sure that everybody on this webinar is aware of is resources for our members for the Society of Trauma Nurses. And that includes the Journal of Trauma Nursing, which is not only in physical paperback, but also can be found online. There's also access to the e-library that has a multitude of resources for our trauma colleagues. Also webinars, just like this one, both live and on demand, as well as an engagement committee journal club. There is mentorship opportunities, so we pair experienced trauma program managers with those individuals who are seeking to learn more and would like a more focused attention and help in their development of their programs. And then coming soon, we also have nurse orientation modules. So there's a lot of opportunities and benefits to being a member of the Society of Trauma Nurses. Next slide. And because we would like you to join our membership, this is a QR code that you can utilize to join the STN.
Thanks, Tracy, and thanks to all the speakers. I'll just give people a moment to use that QR code. We've heard some wonderful resources that are available out there, education and training programs, and the survey which looked at the needs analysis. We have our members, international members online. So we think this is a great opportunity to hear from you, the participants. There is a question in the, we might move to questions now. If we go to the next slide now, thank you. We know we get a bit shy with using questions, but we would love to hear from you. I'd love to know where you're from and what role you do. And most importantly, what can we do for you? The Society of Trauma Nurses has very generously supported the GTQI, Global Trauma Quality Improvement, and the International Council so that we can represent trauma nurses around the world, and hence why we have representation from every corner of the world, besides Antarctica or Arctic, but there's nobody living there currently, or no trauma centres. So we'd love to hear where you're from, but in the meantime, I think there's one question there, and I think it's going maybe directed, maybe Mike is going to answer it. So Cedric, thank you for your question. Cedric has said, thank you for this great mission. How can small centres partner with ATCN to enhance this training and improvements in our countries? And are you happy to answer that? Is it Mike?
Yeah, I can
Steve?
answer that. Hi, Cedric. I think the key to trauma education is to understand what the available resources are locally. Not every country has the resources or support to run a full ATCN program. There are lots of other trauma educational opportunities out there, and you heard about a couple of them here today. But I would encourage small facilities that maybe not running ATLS or ATCN programs to reach out to those leaders that are running the ATCN programs. Find out where there are opportunities for expanding that program within a country, or looking at what are the other resources that are available. What currently existing courses can be started or enhanced, or what needs to start if there's a hole or a gap in the educational process regionally or locally. This is something that I think the resources that you've heard about today are really interested in hearing about and helping to fill. So I hope that helps a little bit.
Thanks, Mike. Amanda Klett has popped in the chat that she's keen to collaborate with TPM globally. Amanda, are you able to unmute and talk to us and tell us where you are and how we can work towards achieving that goal? Stephanie, can I confirm that participants have the ability to speak, or is it just the chat?
I actually just did unmute or allow Amanda to speak if she is able to do so. I can do it on a case by case.
No problem.
But I'm not
I'm
sure
not sure
what
if
her.
you can.
There we go. Yeah.
Can you hear me? Hi,
Perfect.
greetings. I'm Amanda. I'm from Cape Town, South Africa, even although it doesn't sound like it. So I'm a trauma program manager in South Africa. There's very few of us here. We started Trauma Systems a few years ago, but there's only a few of us that have been doing it for a fair amount of time. So I'm very keen just to link up with trauma program managers globally, because I think we have a fairly good, robust system going here in South Africa with Trauma Society. And it would just be nice to meet up with other trauma program managers, see what you're doing in your countries. We can share maybe what we are doing in South Africa and how we can just help each other with making a difference globally.
Thanks, Amanda. And like you, I am not from Australia, originally from Ireland. So it's sometimes a little bit confusing when I introduce myself as well. To the rest of the STN international members and to Stephanie online, would we, something for Amanda and others who are online, would be using the discussion boards for the trauma program managers. Tracy, would you like to answer that question?
I would love to. I think that this is a great opportunity to encourage our international partners to get involved with STN. There's so many opportunities to be a part of committees and to share that information. And I know that we are going to be developing a special interest group related to performance improvement. And so there are other special interest groups within the Society of Trauma Nurses. And so really the Society of Trauma Nurses is really just has so many valuable resources and committees and groups, and it's really limited by how much you want to get involved. And so I would challenge the people on this webinar to join a committee, to get involved with a special interest group, and really start to open up those resources that are available through the Society of Trauma Nurses.
Thanks, Tracy. And thanks to Hannah, who's dialing in from New Brunswick in New Jersey in the US. It's an early start for you, Hannah, so welcome. Glad you're enjoying it. And to Supa, works as a trauma program manager at the Royal Phnom Penh Hospital in Cambodia. Welcome. So the big challenge is how to train a new ER nurses and critical nurses to provide those nursing care appropriately and follow the trauma protocols. I might hand over to Krongdai to answer that. Krongdai, are you happy to take a shot at that? You need to unmute, Krongdai. Thank you.
Sorry. Thank you, Helen. Thank you, Supa. Thank you very much for you interested in the training course. So now, because it's in Cambodia, we have no ATLS or we have no ATCN course. So I prefer to WHO basic emergency care course is I think it's appropriate for the Cambodia now. So you can because in the QR code is have a teaching, have a slide of the teaching and learning about trauma and emergency. So you can learn it. And if you want to STN to set a course for you, please to STN now, please. And you have a membership of STN, and STN everything. If you request, STN always give the knowledge, give you the skill. So membership, please.
Thank you, Crondike. She's a good saleswoman. But a super, I think on that point, what Crondike was absolutely saying, something for if you haven't got access to funds or resources, the basic emergency course. And as we work our way through, then there's the ATCN. But there's plenty of people on this call here today, and the email details should be on the end of we'll make sure they get out to you so you can reach out to us. But I would also encourage you to go to the Global Trauma Quality Improvement Network, and there's resources there in education and QI and the links to all the different things that are available. But I know how tough it can be in low income as well. So thank you for all that you do. Next question is from Ahmed. Welcome, Ahmed, from Saudi Arabia. I'm glad you're enjoying the webinar as well, and that you're an ATCN instructor. Mike, I'm probably going to hand over to you again here. He says ATN instructors and families would like to focus on having presentation material for ATCN candidates, and why not to be separated from ATLS, although I know the importance of being together to talk the same language. You happy to take that one, Mike?
Oh yeah, thanks, Ahmed. You've raised an issue. I think that's a strength and a weakness of the program. Of course, the strength is the team training aspect. We're all on the same page. We're using the same language and training together as a team. But the number of ATLS courses offered worldwide is so much lower than the need for nurses to attend ATCN. So there's an issue there. There are some examples growing around the world of programs where ATCN and ATLS are not running exactly in sync. The new hybrid format for ATLS is allowing ATCN to flourish in areas where ATLS is not being offered as frequently. It's a tough question to say how far away do we move from our foundation of joint education and collaborative team training. So we're trying to balance that, the need for more training for nurses versus the desire to continue to work with our physician partners. But I certainly appreciate your question, and I know a lot of ATCN faculty probably have the same thoughts. How can we expand ATCN and still maintain that connection with our physicians? It's tricky, but people are talking about that. So I think stay tuned. We'll see what happens as the next editions of ATLS and ATCN come out. Thanks, Ahmed.
Thanks, Mike, and thanks for that question, Ahmed. We've got wonderful resources on here, and this is a great opportunity to ask. I know sometimes we get a bit shy, but feel free to type them. But if I go around to the panel, I can't see everybody's face at the moment, but I'm sure they'll come up as I move through. Christiane. We have Christiane Dominguez here from Brazil, who represents Latin America. Christiane, is there any words of advice that you would give to nurses who are working in sort of lower income or lower resource sort of environments about what the services they could access through the International Committee and STN?
Hi, thank you, Ellen. I think STN shows you new possibilities. The resources we have on when a member, you can learn how to do some things. Trauma systems, trauma centers are a new concept in Latin America, so we can learn how to do the work. It is very important to low and middle income countries. It's a great source of things to do the best trauma care.
Thanks, Christiane. And I think we've heard from Stephen and Knut are both in Denmark and Norway, which is through Scandinavia. And I'm not sure if we have any Scandinavians on, but it's not part of the world. But Stephen, is there any take-home messages that you would have, or any questions that you would like to pose to the people who are online?
Just to get involved and remember to use your systems, and we'll be able to help you as much as we can. And eventually we do have programs set up around the world. So whenever you want to, if you feel like it, any of you guys are more than welcome to contact any of us.
Yeah.
Yeah.
I agree. Thanks, Stephen. Knut, someone who's been involved with the international community for a long time, pearls of wisdom that you'd like to share?
Yeah, absolutely. Sorry, so I think it's important just to just follow STN on social media. So we are on Instagram and Facebook and Twitter as well. And then sign up for the newsletter. But in the beginning of my career, the most important thing what I did was actually to attend the TraumaCon, the conference in the US, because then I met the people and then I started networking. And since then I was the international chair for 7 years. So it's a good way to get involved is actually to see people in person and then go to the conference. And the next year it will be in Kansas, isn't it right? Yeah.
Correct. And I wholeheartedly, and we know that that can be cost prohibitive, and that's why we wanted to be on here today. But going to an STN trauma conference it's like coming home when you're a trauma nurse. And if the next best thing we can do besides that, if it's cost prohibitive and people can't get there, we would love you to join us on GTQI and make any recommendations or communicate with us as well, because we want to provide, information that is going to be meaningful to you. I just saw in the chat there that we've got Bronwyn, who's on from Hamilton in New Zealand, a little bit closer to where I am. She says, thank you for a great webinar, and I look forward to exploring the resources on Trauma Quality website tomorrow. I understand that it's, the resources that sit on the GTQI website are for all systems. So whether you have a developed trauma system or there's just some data or some quality improvement initiatives that you would like to run, there's something there for everybody. And, as Stephen said before, we can contribute to those resources by adding to them as well. I'm just going up through the list. Krong Dai. Krong Dai is a representative from Thailand and very well known in Asia area. Krong Dai, you joined the committee about a year ago. Is there something that you would like to share from your wisdom and all of your experience working in trauma across Thailand?
Okay. In Thailand now, we have like a basic trauma, basic like a BTLS, basic trauma life support. But basic trauma life support be after we training in skill station. After that, we have a trauma team response. We have a basic trauma life support. We have a ATCN, my SDN help Thailand a lot. And now I think because we have a basic course, we have an advanced course. So the next time, I think we use basic emergency care course to like a intermediate course. And now in Thailand we talk to the public health and to like if we translate into Thai in a basic emergency care course, and the public health will offer to the about 200 hospital in trauma level 5 in the future. So Kun Supat, if you interested, you can come to Thailand because Cambodia is near Thailand. You can come to Thailand and study with us. Thank you, Helen.
Well, thank you, Krong Dai, and thank you for your leadership in that region. I think we're coming towards the end, but I think Iman is online. Iman, are you able to unmute and give us an overview or some information from Jordan for the nurses there about how we can help them and support them? I can see Iman's name, but maybe she's unable to mute. And look, thank you so much. Are there any other panel members who'd like to have a final say or contribute to the end of the conversation? I would just like to thank all of the participants who've joined today, the 1,000 plus who completed the survey. We will be getting those results out, but there's a multitude of things that are available at free and no cost. We haven't even touched on the World Health Organization quality improvement modules, which I think at this stage are being converted from English to French, Spanish, Arabic, Norwegian, Thai, maybe Danish, can't remember, Portuguese. So that's a wonderful program that if you want to introduce or build on any sort of QI processes that you've got happening in your hospital, it takes you through how to run an entire course there. We would love to hear your feedback, and there's an evaluation there. When you complete that, STM will send out a certificate. But importantly, we need to hear from you. We want to hear your voices. The survey gave us lots of information, lots of valuable resources, and we will use that to target things as we move forward. But it sounds like we have an opportunity to collaborate together, and by doing that, we all become part of that bigger STN sort of trauma nursing family. So thank you for your time today. And I did have a slide with my email on it, but I can't see it at the moment. But it's we might just pop it in the chat if we can. It's helen.jowett. I'm not sure if somebody else is able to type in there at the moment. That's okay. We'll make sure we get it out to whoever's on this call today. But it would be great to hear from you after this and to keep the conversation going and to know that we are here as your representatives, but we can only represent you when we hear from you and act on those things. So on behalf of the International Committee, Helen Jowett, I'd like to say thank you very much. Go. Have a great night. And thank you for joining us wherever you are. And we look forward to continuing this relationship and going forward. Wherever you are, take care and stay safe.